Hey, so if you spent any time on social media lately, you've probably seen these four words thrown around like they mean the same thing. Sometimes weaponized, sometimes just misunderstood. Abortion, ectopic pregnancy, blighted ovum, and molar pregnancy. So my name is Dr. Tashima Fair. I am a board certified OBGYN, and I need to get some things straight. I need to say something plainly. These are four medically distinct diagnoses. They are not interchangeable. They are not political synonyms for each other, and conflating them, whether out of ignorance or intent, puts real patients at risk when policy gets written by people who don't understand the difference. So, in today's video, no opinions yet, okay? It's just the medicine. So, we'll go condition by condition. Stay tuned. All right, now I got to take y'all back to the basics. And before we get into the four diagnoses, you need four simpler words first because I'm going to use them throughout, and getting them right really matters. First one, zygote. This is day zero. It's a single cell formed the moment sperm fertilizes the egg inside the fallopian tube. Blastocyst. By day 5 to 6, that single cell has divided into a hollow ball of cells. This is the stage that actually implants into the uterine lining. This is where a pregnancy either successfully attaches or doesn't. Embryo. Once implanted from about week 3 to week 10, it's called an embryo. This is the stage where organs and major structures are forming. Fetus. From about a week 11 onward. Once the basic body plan is established, it's called a fetus, all the way through birth. So zygote, blastocyst, embryo, fetus. One cell to a hollow ball to an organ forming structure to a fetus. Keep that timeline in your head because it's going to matter in every single one of the next four sections, especially the blighted ovum and molar pregnancy, where the issue is actually a failure at the blastocyst stage. Got it? Oh, first one, abortion. We're just gonna get this one out the way, okay? The medical term for the termination of a pregnancy before viability. This includes both spontaneous abortion, called a miscarriage, and induced or elective abortion, a chosen medical or surgical procedure to end a pregnancy. The clinical presentation varies. Elective abortion is a planned intervention. Spontaneous abortion presents with bleeding, cramping, and passage of tissue. The management can be medication, either something like Cytotec, or it can be a surgery like a dilation and curettage or aspiration, depending on the gestational age. Key point is abortion is an umbrella medical term. Most people don't realize their doctor uses this word every time they discuss a miscarriage. It is not by itself a description of intent or circumstance. Second one, ectopic pregnancy is a fertilized egg implants outside the uterine cavity, almost always in the fallopian tube, but can occur in the ovary, the cervix, or the abdomen. Presents with pelvic pain, abnormal bleeding, and can progress to tubal failure, internal hemorrhage, and hypovolemic shock, and even death. This is never a viable pregnancy. There is no version of this diagnosis where the pregnancy can be relocated or saved. Management is either with methotrexate or surgical removal, like a salpingectomy or a salpingostomy. This is an emergency, life preserving care for the mother. All right. Key point here is this is a diagnosis most frequently and most dangerously entangled in the abortion restriction legislation because some laws are written without clear medical exception for it, despite it having zero overlap with elective termination as a concept. Third one is blighted ovum. Okay. Remember the blastocyst stage we talked about? This is what happens when that hollow ball of cells implants and forms a gestational sac, but the embryo itself never develops inside. Okay. The definition for that is it's a fertilized egg that implants inside the uterus. A gestational sac forms, but the embryo never develops or stops developing very early, also called an embryonic pregnancy. It often is discovered incidentally on ultrasound. The patient may have had some normal early pregnancy symptoms, a positive pregnancy test, but then there's no fetal pole and there's no heartbeat on the ultrasound. We can manage it either with watchful waiting, medication, or DNC. This is a form of early pregnancy loss. This is not a choice, okay? This is one of the more common, least talked about forms of early miscarriage or pregnancy loss, and one that patients often carry guilt about unnecessarily because they don't understand it. It was never a viable pregnancy to begin with. 4. Molar pregnancy. This is another blastocyst stage failure, but this time instead of nothing developing, the placental tissue itself grows abnormally. Okay, it's defined as abnormal fertilization, which creates abnormal placental tissue, also called trophoblastic tissue, instead of or alongside a normal embryo. A complete mole is no fetal tissue. A partial mole is some fetal tissue, but it is non viable. It usually presents with heavy bleeding, usually a high HCG, a snowstorm appearance on ultrasound, and can be associated with severe nausea and high blood pressure early on. This requires evacuation of the uterus. This is not optional. You got to do a DNC because molar tissue carries a risk of progressing to gestational trophoblastic neoplasia, a malignancy. Patients require HCG monitoring for months after. This is the clearest example of why just let nature take its course is not medically safe advice for every pregnancy complication. This one can become a cancer risk if left untreated. Got it? Okay, good. So, 4 different diagnoses, 4 different mechanisms, 4 different treatments, and only one of them, elective abortion, involves an actual choice about an otherwise viable pregnancy. Here's where I step out from behind the textbook for a second. And as a physician, I don't think legislation should be written or defended by people who cannot tell these 4 things apart. When a law doesn't carve out clear medical exceptions for ectopic pregnancy, molar pregnancy, or non viable losses, it's not a moral stance, it's a medical failure. And it costs women their organs, their fertility, and sometimes their lives. That's not a talking point. That's what I've seen in the OR. All right. That's my one opinion for today. Like everything else is fact. Everything else was just the diagnosis. Okay. Now, if this helped you understand the difference, go ahead, subscribe to this channel, drop a comment with what you want explained next, and share it with someone who's repeating one of these words without knowing what it actually means. In the meantime, in between times, stay healthy, Stay vibrant and stay unconventional. I will see you in the next video. Peace.